So we had talked previously in one other lecture about not necessarily how longevity has been extended, but how the human lifespan, or that sort of mean age for humans, has been extended throughout the course of the 20th century. And so when we look back through history, the average lifespan for a human was somewhere between 30 and 40 years of age, which, as we think about it now, is relatively young. Because from 1920 to 1950, the average human lifespan increased by over 75%. And we went from having an average life expectancy to in the 50s, early 50s, to having a life expectancy of almost 80 years old. And there are a couple of factors that led to this lifespan extension in the 20th century. And one major one was the control of infectious diseases. It led to a huge increase in that average human lifespan. And it started earlier than the 1900s with the invention of the microscope and the discovery of bacteria as infectious agents in the late 1600s and early 1700s. And so Anton van Leeuwenhoek discovered these small molecules or bacteria, and then we slowly gained the knowledge that bacteria are actually the agents or causes of infection, which led to some public health policies being established in the 1700s. And then in 1800s or early 1800s, I guess, Edward Jenner developed the first smallpox vaccine and studied inoculation against viral infections. And then by the late 1800s, vaccines were being widely produced on a big scale, and pasteurization, or sort of that removal of microbial agents like bacteria and viruses from food, was also gaining popularity. In the early 1900s, policies were starting to get put in place that would ensure safe water and food, so sanitation of both water and other kind of big food products such as milk, as well as to ensure that sewage was being properly treated and microbes removed from that. And then by the 1920s, particularly in the United States, there were government-mandated sanitation programs to clean the water, to clean, as I said, milk, to remove microbes from that, in order to control some of these infectious diseases caused by bacteria. And also in the 1920s, there was the beginning of sort of a government-mandated vaccination, particularly for young children. And all of these things together led to the understanding and then the ultimate control of infectious diseases caused by bacteria and viruses, which for much of the early 20th century and before that were the top causes of death. And so you can see here in 1900 and 1920, the top causes of death were pneumonia and influenza, both of which were caused by an infectious agent. And in 1900, tuberculosis, as well as the foodborne illnesses and diarrheal diseases, also led the pack in terms of causes of death in the United States. And once we began to understand more about these infectious diseases and start using antibiotics, vaccines, as well as having these widespread kind of sanitation and pasteurization efforts, these diseases started to dwindle, and the top 10 causes of death shifted to things that are more related to genetics and age than to infectious agents like bacteria and viruses. And this is just as kind of an aside to show how effective vaccines are at reducing the number of cases as well as the number of associated deaths. And so you can see some diseases caused by viruses or bacteria that can be vaccinated against: diphtheria, mussels, pertussis or whooping cough, smallpox, tetanus, and the number of pre-vaccine cases and deaths, and then the percentage in reduction of cases or deaths after the introduction of a vaccine. And the numbers are staggering. They're 100% or 99%, 100% for polio. And so vaccination is really probably as close to a medical miracle as anything we've ever seen. And it's one thing one reason that we're really striving towards making a coronavirus vaccine that can fight COVID-19, because vaccines are incredibly effective at reducing not only the number of cases, but also the deaths resulting from these diseases. And so, in addition to controlling the kind of infectious agents and an increased understanding in how to treat disease, a decrease in infant mortality also helped to increase the life expectancy of humans and push or extend the lifespan in the 20th century. And so, infant mortality rate, or the death rate of very young children or infants, just mathematically ends up playing a large role in life expectancy. And so, as you can see here in this graph, infant mortality rate actually plummeted in the early 1900s for a couple reasons, and life expectancy at birth increased as a result. And so you can see some of those reasons for the increase in or decrease in infant mortality over here. There were public health initiatives to educate the public about those infectious diseases, which tend to affect children and infants at a higher level because of the underdeveloped immune system that infants are born with. Over time, they do develop immunity, but early in life, infants are particularly susceptible to infectious disease. And once we knew that, we were able to fight it. One way we could fight the infant mortality associated with disease was by the widespread vaccination of infants. Additionally, we can eliminate some of the potentially unsanitary conditions of children being born at home, by midwives, by having children being born in hospitals. And hospital births increased dramatically in the early 20th century. And these sort of three things in concert have worked to decrease the infant mortality and push life expectancy forward. But infant mortality is something that continues to suppress life expectancy in other countries. So high infant mortality rates are generally associated with smaller economy or economically less developed countries. And so you can see some countries here that still have a very high infant mortality rate. In some cases, like Afghanistan, it's 10%. So 100 out of every 1,000 infants actually dies, and it suppresses the ultimate life expectancy by a lot. And so that developing economy and society that can support public health initiatives, vaccination, and hospital births as one way that you can decrease infant mortality rate. And unfortunately, it's just something that some of the less developed countries don't have access to. And additionally, we have been improving medical treatments, not only in terms of childbirth, but also in terms of diagnosis, prevention, and treatment of some of the new leading causes of death, such as heart disease. And so in the last 100 years, medicine has made a lot of progress. So in addition to being able to remove some of the major causes of death by controlling disease, we've also now been able to extend people's lifespan who do have some of these sort of like genetically inherited and age-related diseases like heart disease by improving our understanding of them. And so in this graph here, you can actually see the age-adjusted deaths from some of the leading causes of death in 2020, like heart disease. And we can see that in 1970s, the death rate was much higher than it is today, because we have sort of pushed not only the diagnosis of heart disease forward, but also methods to prevent it and ways to treat it so that people can have heart disease and still actually live to an extended age rather than die. Additionally, because of the sort of improved medical treatments, humans are living much longer than they ever have, past the age of 65. And so this graph shows the additional years of life expectancy after age 65. And so in 1900, that number was much lower than it is today in 2020. And so that improved medical treatment and care related to sort of these age-related issues and diseases has improved and helped us increase life expectancy as well. And so for the Remainder of this class, we are going to discuss the age structure of the United States, as well as some of the implications of extending both the longevity of humans as well as human lifespan. Because we generally think about these things as being relatively positive. Extending lifespan and health span is good, but there are some drawbacks to doing that as well, particularly in terms of society. And so the lecture questions will help you kind of think through some of these interesting implications that are associated with that lifespan extension in humans.